Sharing my screen now. I hope that each and every one of you can see the slides. I am Giovanni Briganti. I am a medical doctor and psychiatrist from the University de Bruxelles in Brussels, so Belgium, and I lead the health group of AI4 Belgium, which is the national Belgian coalition for artificial intelligence. Today, I'm here to talk to you about how we are using AI and health data to move forward in Belgium and improve the quality of care. So I will start by doing a paradigm shift. Artificial intelligence and big data allowed us since the pandemic to kick a boosting start into a new whole paradigm of how we do medicine. I will divide the two main fields into a clinical field, which is commonly known as augmented medicine, that is using new AI tools powered by big data to better deal and treat with human disease. And for all the other aspects, those who do not directly concern the medical doctors and the patients, I will call that paraclinical AI. That is the AI that will deal with a whole lot of new ways to organize, better administrate healthcare organizations. Which are the domains of interest of this new paradigm? For the clinical part, of course, we have different fields, and the first one being monitoring. We are able with AI to use those technologies to better monitor diseases after having diagnosed the patient with it. And while we monitor that, while we monitor the patient from a distance, we're able to predict whether if a new complicated event will come or not. And that is called prediction AI, of course. Prediction AI is commonly useful to predict events such as hypertensions, hypoglycemias, stroke, myocardial infarction, and other problems, and are mainly used within monitoring technologies to prevent some things. AI can be used to diagnose diseases, such as within clinical imaging and clinical pathology. That is, each time we have a specific specimen coming from the individual that can be diagnosed with technology based on previous samples. We can use AI to prevent further developments of a given disease. For instance, in the case of diabetes, we can use specific technology to learn how the individual glycemic rates go up and down during the day and better prevent hypoglycemic episodes. Afterwards, there are platforms that can couple one or more technologies to better treat the patient and better present to the doctor results from monitoring, prediction, diagnosis, and prevention technologies for patients. And there are platforms for clinical intelligence that help the doctor make decisions. Other fields of how AI and health data are shaping the new healthcare is, evidence-based practice. That is, platforms that are data-driven. They pile on data that comes from different hospitals to drive clinical decision support in a given hospital for a given case with a given doctor and patient. Outsourcing genomics is a useful tool with modern technologies to do some genetic tests and prevent and predict nefarious diseases in patients. We can now also outsource clinical trials with platforms such as CHU data platforms. Patients can directly enroll from a distance into clinical trials, and this solves one of the biggest problems in healthcare, which is clinical trials and how to recruit patients. Smart history taking is taking away the administrative burden that comes with writing discharge summaries and writing entry summaries for patients, since the patient takes an active part of writing his own story. And of course, teleconsultation, which has been driven crazy by the COVID-19 period. What are the challenges in AI technologies? Well, the first challenge is that models are often developed using too small data sets and too small studies, which means that when those models are applied in other settings, well, because the data was too reduced and too restricted to a given population, well, we may have two challenges. The first one being that, well, models do not replicate and results do not replicate into different populations that the ones that were used in. And the second challenge is the problem of overfitting. That is, the model, well, optimally fits the training data set, that is the source data that was used to develop the model. But when it is applied into another populations, well, the model just works less well. And well, the open solution to that is to use open data and open science to develop algorithms based on larger data sets for larger communities. Well, some parts of some Belgian governments, such as the Wallonian government in Belgium, have rendered mandatory, the fact of publishing data from clinical studies so that people can reproduce and replicate those studies elsewhere. So that is a great place to start, but we now need some way of exploiting the data that is into the hospital and is difficult to take care of. The third challenge is the study of AI versus human doctors. And this is a complicated point, since AI, the AI revolution has been driven by industry who wants to prove that their own technology is as good as doctors. Therefore, the clinical studies will be tailored to prove that their technology is as good as doctors. However, this does not apply in clinical settings where doctors and technology do work together for the best interest of the patient. And as of nowadays, we now lack many studies in the AI field and big data field that combine the forces of AI and physicians to drive change. So this is why we launched in Belgium to answer those challenges, the AI4 Health work group within AI4 Belgium. AI4 Belgium is the grassroots community for innovation within AI, which is launched by the federal government in Belgium. It is managed by Nathanael Ackerman, which is the AI national expert for the federal government. And our objectives were to stimulate AI adoption, build a climate of trust, to build an ethical framework, and of course to compute the first basis of data governance within healthcare institutions and AI cartography. Belgium is a really vibrant ecosystem for AI development and big data solutions. We have so many companies, as you can see in this slide. The cartography was done by Nathanael Ackerman and the AI4 Belgium team. So many companies that work on AI and big data. And our work group is at a national level, the one that enables all these partners to work together to improve how AI changes the healthcare world. To start with, we did a barometer to measure and assess the AI adoption in hospital. It was co-driven by us with the help of Ernst & Young cabinet and Le Spécialiste, the specialized journal for specialized doctors. Well, overall, our barometer showed that hospital managers and physicians view AI as a positive or really positive development, and they see it as a really good opportunity for improving the quality of care and security of care within hospitals. But they also see that AI is still not a strategic priority in most, if not all, the hospitals. And we had all hospitals who answered our survey. However, one of the key points of the survey was that doctors think that AI can free up time for added value tasks because they realize that the modern healthcare world has given doctors some tasks that shouldn't be given to doctors in the first place, such as administrative tasks. So this is an important point that AI can help. One of the needs that we are trying to drive in Belgium is the need to educate doctors that understand both worlds, that is the medical world and the AI and big data world. And those are needed to drive innovation, to drive change within healthcare institutions, within primary care, but also at a national level and the policy level. we also realized that education done differently for AI for medical doctors and healthcare professionals is needed, because especially physician, the role of physician will shift with AI. As of right now, physicians use their position of privilege to know a large number of pathologies, such as for the general practitioners, and the specialist doctors only know a very, very specific field of interest. However, the AI and big data technologies will allow general practitioners to know much wider areas of expertise, while the specialists will have to deal with broader areas also within their own area of expertise, but to deal with more severe pathologies. So we are realizing that the healthcare innovation within AI is taking a bit long to put in place. But why? Because we have too many tools to choose, and we do not choose the right use cases, but we do know what use case to choose in order to drive change in a meaningful way. We need to prioritize how to outsourcing healthcare, that is a task that can be done at home and not in the hospital or the general practice, to outsource history taking so that administrative tasks are reduced to a maximum amount, to drive prediction through monitoring, pseudonymize data, and use federated learning, that is, we let data stay where it comes from, that is hospital, and algorithms go to the hospital to train themselves, and we do not need to extract the data from the hospitals. These are the promising areas, and we need to invest in those areas to drive meaningful change. And that is what we are doing with the AI for Health program. We do know that the pillars of AI innovation is not the industry alone. Within industry, we also need doctors and healthcare professionals, hospitals, universities, government, and patients association. Within the case of Belgium, this is mandatory because we need all the actors together to drive meaningful change. And as I said, one of the problems is that there are too many solutions available on the market, and governmental changes do not know what solutions to tackle with, because each solution has a very narrow digital ecosystem and a very narrow area of expertise. What we should drive forward, what we should move forward, are interdisciplinary solutions that emerge from collective expertise and from different stakeholders. So we need broader solutions that are driven together by consortia of different expertises. Those will drive change. Invest in security, especially of data, and invest in federated machine learning strategies to better drive change, and to have an open development, of course. In conclusion, AI and big data will not change what it means to be doctors and what it changes to be, to be taken care of when we are patients. It is a support, and we should use that as a support. As an agenda for the next 10 years, we need to study the combined forces of physician plus AI, that means also exploiting in the right way clinical data, and do translational clinical trials to really prove the added value of those technology. We are right now in a position of privilege, but we might not be tomorrow. So we need to drive change now with the right solutions, with the right partners, and within our own standards. So thank you very much, and I'm more than happy to answer your questions.
Thank you very much, Giovanni. This is great, and this was also not behind the time allowed. That was even greater. So we have time for questions from everybody, and yeah, it's great to begin with Belgium. That's a great country, really. Even if I'm from there, I can say it. For all questions related to sharing of health data, even if it's probably not the best one, but one of the best ones. So please, waiting for the first question. The first question is, of course, always difficult, I know, but still, still. Otherwise, I will have to do the first question. Nobody, please. Okay. I tried the first one. So once again, thank you, Giovanni. In the, let's say, best world situation, when do you think that we will have at the Belgian level a possibility for scientists to reach health data of citizens? I know that you have one project with other hospitals. So tell me, best case situation, best world situation, best case situation. When would be this concrete possible?
So I think we'll need some, we still need some 2 to 3 years for all the relevant stakeholders to really grasp the interest of having a national AI strategy. Because the federal government has seized the opportunity, has launched AI4 Belgium, but we still need to showcase to both policymakers and the population how in a pragmatic way of doing AI can change healthcare. One of the first challenges to tackle with, and I know we're in a good way towards it, because the National Administrator for Health Data in the eHealth platform, Thibaut Duvillier, it has the same view as I do, is that we need to render all the medical data accessible, of course, to the patient. And the key is interoperability through the patient. So this may take some few years more, but since when we will have done that, AI development will be much, much easier. So I expect that within the next 5 years, we will make use of AI and personal data on a large scale in at least 5 to 6 hospitals, big hospitals in Belgium. We are starting to do it right now. There are several programs, but still need more time for reimbursement policies to have some first pilot projects to pile on.
Okay, thank you. Do you have other questions? If there are no other questions, we will already have the second speaker today.
There are 2 questions,
okay.
Didier. So I have a question from David
chat.
Wood. I have a question from David Wood.
Okay, go ahead,
Do
David.
you expect the best medical solution to come from small startups or from large IT companies? Okay, this is a good question. In my experience, small startups come up with the best idea. However, one small hiccup from startups is that their ecosystems can be too narrow if they do not collaborate with larger platforms. From the other end, large IT companies may come up with also good ideas, but that will make sense if a healthcare institution already adheres to their own internal ecosystem, and which is also problematic. This is why, and this is what we are doing in Belgium, we are gathering all the people that drive AI innovations, small startups, big companies, but also the other sectors, the medical sector, hospitals, doctors, nurses, to drive innovation as we wish. That is, to be compatible with hospital systems, to innovate through medical data and EHR, and so on. So good ideas can come from both, but the Belgian ecosystem is really lucky to have a very vibrant ecosystem that come from both small and big data, big companies. Yeah.
Thank you. There is also an interesting question from Shai. Do you expect to get social data as well as medical data? Do you have projects for this aspect?
Yeah, there are several companies that are looking to gather the social data to include into the medical records, and as of now, this is a big barrier to deal with, because medical doctors are not used to include social data within the healthcare frameworks. But there are some companies that want to include those data into that. Another cool application is to use behavioral data to solve major psychiatric problems, of course. So yeah.
Thank you, Giovanni. I think that there are no other questions. Yes.
Yeah. So I would like to ask, so there are certain countries, most well known is of course China, who have very large data sets from their population, and they are relatively easy to access and use that for Chinese companies. We in Europe have much stronger privacy laws and make exchanging data more difficult, and Belgium, of course, is a very small country. So what would you say are the strengths that Belgium has compared to other countries in developing AI solutions?
That's a great question, Sven. Thank you. One of our main strengths is that we have a national EL strategy that has been put in place to gather all the medical data from the main regions. That is, a medical doctor can now access all the medical reports from a given patient that have been generated in Wallonian region, in the Brussels region, and in the Flemish region. Those are three separate networks, but for instance, I, as a Brussels doctor, I can access all the medical data from either of the regions for a given patient. This is amazing. So we have this already in place. So this is one first strength. The other strength is that Belgium is a small country, but we have so many universities and so many companies. So and hospitals are also looking to improve themselves. So this is another strength that comes with our own ecosystem, is that to innovate, you really call the people up and say, okay, let's do it together. Let's get AI for health going, for instance, and they all will come. And it's so, as I said before, our major strength is a vibrant ecosystem plus a health data strategy from a national point of view, which is solid and is still going forward, but we can improve it, of course, but it's solid. And well, an AI, well, the existence of an AI coalition, which does not exist in every European state and even abroad. Yeah.
Okay, thank you, Giovanni. So let's